Okay, so to continue our lesson on the drugs affecting cholinergic neurotransmission, we have your acetylcholine antagonists. Or for short or simple terms, they are referred to as your anticholinergics. Okay, medyo short man gud siya, anticholinergics na term. Now, for anticholinergics, we have two subclasses. We have the natural anticholinergics, and then we have your synthetic anticholinergics. Natural and synthetic anticholinergics. Natural in a sense na obtained siya from a plant source. Synthetic, made in the laboratory. So first, let's have a brief description of your anticholinergics. By the way, I already uploaded the summary of this lesson last Monday. Sorry ha, dapat i-upload din ako siya yung before intrams pa talaga. Nakalimutan ko lang talaga, sorry. Ang na-upload ko lang is the video lecture but not the handouts. But I already uploaded the handouts last Monday, March 28. Excuse me. Okay, so to continue with our lecture, acetylcholine antagonists, they have binding affinity to the muscarinic receptors, but they lack intrinsic activity. So when we say antagonists in a general sense, these are agents that have affinity but no intrinsic activity. Kumbaga, walang response silang gina-elicit. They just block the binding of the natural ligand to its receptor. Now, other names of your acetylcholine antagonists are anticholinergics, antimuscarinics, cholinergic blockers, antispasmodics, and parasympatholytics. Now, similar to your acetylcholinesterase inhibitors, anticholinergics are also non-selective. Ibig sabihin nito, they affect both the muscarinic and the nicotinic receptors. So non-selective sila, similar to acetylcholinesterase inhibitors. Non-selective sila for muscarinic and nicotinic receptors. Pero in a way, manggod, if you would look at it in hindsight, medyo greater lang talaga ang effect niya sa muscarinic compared to the nicotinic. So that's why medyo mag-superimpose ang muscarinic na blocking effects unlike the nicotinic. Pero ang anticholinergics talaga technically, they are antagonists at both muscarinic and nicotinic receptors. So ano lang ha, if you have any questions, feel free to ask lang. Alright, therapeutic application of muscarinic antagonist or anticholinergics na lang para simple. Responses are the complete opposite of your acetylcholine mimetics. Kung ang acetylcholine mimetics associated siya with bradycardia and increased secretions, opposite siya for anticholinergics. So ibig sabihin nito, you can expect na mababa ang secretions, decreased contraction. Nakalagay nga dito, responses include decreased contractions of the smooth muscle of the GI and urinary tract, making it indicated or useful for overactive bladder. So ito yung sinasabi ko, ito yung nasa activity natin earlier, yung urinary incontinence, yung wala kang control sa bladder mo. So one of the treatment for that condition is your anticholinergics, decreased contraction of the urinary tract. Another possible application is it is a mydriatic agent. It causes pupillary dilation. So therefore, being a mydriatic agent, dili jud siya pwede for patients with glaucoma. Kay it will worsen the intraocular pressure. Musmusamot ang kondisyon, glaucoma. So bawal siya. Kung ang acetylcholine-mimetics indicated siya for glaucoma, ang ating anticholinergics contraindicated. Bawal sila for glaucoma. Okay, next, reduced gastric, mucociliary, and salivary secretions. So kung ano yung mga kondisyon na contraindicated sa mimetics, indicated siya for anticholinergics. Okay, next, treatment of smooth muscle spasms associated with the increased tone of the GI tract or with an overactive bladder. It reduces gastric acid secretion, making it useful for the management of gastric ulcers. It is used in the reduction of nasal and upper respiratory tract infections kasi ang ating parasympathetic division when stimulated causes increased bronchial secretions. So making it like disadvantageous for patients who have bronchial conditions like asthma. So mas mahirapan sila maghinga. Okay, so kumbaga, this is like a summary of the anticholinergic effects. Kung sa acetylcholine mimetics, we have the mnemonic dumbbells and sludge na reference. For anticholinergics, meron din tayong separate na mnemonic. Pero before we proceed to that mnemonic, we have the illustration here for the anticholinergic effects. It causes urinary retention. It causes dry systems, dry throat, dry mouth, constipation, feeling hot because of the decreased sweating, tachycardia, increased heart rate, blurred vision, dry eyes, kay midriatic agent, magod siya, pupillary dilation, and sedation, dizziness, confusion, and hallucinations. Kay in a way manggod ang mga anticholinergics, they exhibit an antihistamine effect. So they are able to cross the blood-brain barrier, causing the sedation effect of your similar to the sedation effect of your antihistamines. Okay, and other therapeutic application din pala of your anticholinergics, specifically scopolamine. It is in the form of a patch transdermal delivery system. It is used for the prevention of motion sickness. And some anticholinergics also are indicated for the management of Parkinsonism. Parkinsonism. So Parkinsonism, it's a condition associated with the decreased levels of dopamine. Mababa ang dopamine. Now, ang relation daw ng neurotransmitter na dopamine and acetylcholine is para daw siyang siso. Kapag increased yung isa, mababa yung isa. So parang siso ang kanilang effect. So for Parkinsonism or Parkinson's disease, mababa ang dopamine. So expected na kung siso effect man sila, ibig sabihin nun mataas ang acetylcholine levels. So with the help of anticholinergics, ipababa niya, ipa-level niya para mo-balance ang levels sa imuhang dopamine and acetylcholine. So ang mga anticholinergics, they have utility for Parkinson's disease. Okay, now, kung sa ating mga acetylcholine mimetics out, we have dumbbells and sludge. For anticholinergics, we have this toxidrome na mnemonic, blind as a bat, mad as a hatter, red as a beet, dry as a bone, hot as a hair, stuffed as a pipe, with the following meanings of each term or each phrase pala. So blind as a bat, it's related to mydriasis, mad as a hatter, confusion or delirium, something to do with the sedation effect. Red as a beet, flushed skin. Dry as a bone, dry skin because of the lack of secretions from your glands, organs. Hot as a hair, kay nga, decreased sweating. At dry skin, anhidrosis. Dry as a bone. Stuffed as a pipe, related siya to your urinary or bowel retention. Kay dili man mag-contract ang imong smooth muscle. So, opposite lang jud siya to the rest and digest na phrase with your acetylcholine mimetics. Okay, so let's discuss the compounds for your anticholinergics. So once again ha, ang ating mga anticholinergics, we have the natural and the synthetic ones. So the natural, we have first one, atropine from Atropa belladonna, a plant. So atropine, the other name of your atropine, it's also known as your hyoscyamine. It is the first compound shown to block the effects of muscarine. So clinical uses of atropine, actually dagag utility, dagag use ang atong atropine. It is used for the treatment of bradycardia, slow heart rate, kay ang atropine, an anticholinergic, causes increased heart rate. So antidote siya or treatment siya for bradycardia. It is a pre-operative agent to reduce the secretions prior to surgery. It is used also for the management of Parkinsonism. Another, it's a mydriatic as well as a cycloplegic agent. And then finally, it is used or it is one of the antidote for the organophosphate poisoning. Organophosphate poisoning, organophosphate natin kay it belongs to your irreversible cholinesterase inhibitors. So expect ng effects niya kay related sa secretions. Like for example, lacrimation, salivation, sweating, breathing problems, and most especially bradycardia. So ang ating atropine, it addresses the symptoms of the organophosphate poisoning. So gina-decrease na niya ang lacrimation, salivation, sweating. It causes increased heart rate to address the bradycardia, and it addresses the breathing problems. Pero ang atropine lang ha, symptoms lang siya. Pero the underlying condition, it is treated with pralidoxime. Yung underlying na yung pag-inhibit sa enzyme, pralidoxime ang antidote. Pero ang atropine, it's more of the symptoms. Okay, atropine, it is contraindicated in glaucoma because it's a mydriatic agent. Considering na mydriatic agent, it can increase intraocular pressure. Usually, manggod ang mga mydriatic agents, ginagamit sila for inflammation of the eye, yung uveitis, iritis, eye inflammation, mo na ang utility sa atong mga mydriatics. So, bawal ang mga mydriatics with glaucoma. Kay mas mosamot ang kondisyon. Okay, and that's the first one. The first natural anticholinergic. The second one that we have, it's your scopolamine. Scopolamine, the other name of your scopolamine, it's also known as your hyoscine. Familiar kayo with Buscopan, hyoscine, and butyl bromide. Okay, so scopolamine, it is marketed as a hydrobromide salt. Hydrobromide salt. So, considering na hydrobromide siya, bromides, pag tandaan lang natin na for bromides, these are ions na related siya to the depressant effect. So kaya naka-state dito na ang scopolamine, it is a CNS depressant, whereas other antimuscarinics like atropine are CNS stimulants. Okay, so yun siya yung ating dalawang anticholinergics, natural anticholinergics. Additional information for scopolamine, treatment of uveitis, iritis, and Parkinsonism. Considering na mydriatic siya, it is specifically used in the form of a transdermal patch for the management of motion sickness. Okay, so natural, atropine, scopolamine. Now, how about for the synthetic anticholinergics? Your synthetic anticholinergics formed their basis from the structure of atropine. So kumbaga, kung tutuusin ninyo parang prototype ang atropine natin for anticholinergics. So bale, gibasa nila ang structure sa atropine. So ang atropine, again it's an anticholinergic. It opposes the effects of acetylcholine, the natural neurotransmitter. Now, if you were to look at the two structures, atropine at saka acetylcholine, both of them, they contain similar functional groups. Kung titingnan ninyo ang atropine at saka ang acetylcholine, they contain the nitrogen group, the ammonium group, tertiary, quaternary ammonium group. It also contains an ester functional group. Tapos meron silang ethylene bridge, ang dalawa. Pero kung titingnan ninyo ang atropine, medyo bulky siya. Marami siyang carbon sa bridge. So, if you were to look at it, ang atropine and acetylcholine, their main difference is on the size of the acyl portion. Ibig sabihin nito, medyo bulky ang structure ni atropine kumpara nimo kay acetylcholine. So the size of the acyl portion is a significant factor in its blocking action and its function as an anticholinergic. Murag tanawon niyo ba kung in a way kapag mas malaki, gagmay, mas ma-overpower niya ang pag-bind sa receptor kaysa sa natural na neurotransmitter. Okay, so this time, let's talk more about the structure-activity relationship of your anticholinergics. Kay mao man jud na siya ang focus for this subject, to relate the structure of a drug to its response or to its therapeutic benefit. So actually, if you would read the book, medyo complicated siya ang pag-understand ng SARs. So ang ginawa ko, I simply summarized the concepts for SARs. So mo ni siya, looking at your kaning right na figure, mo ni siya ang basehan nato for the SARs for the anticholinergics. So looking at here, meron tayong R1, R2, may benzene structure tayo, may X, may CH2N, at saka may N tayo. So may significance yan siya. Later on, or in the next slide pala, in the study of SARs. Excuse me. All right, so there are 5 entries related to the SARs of your anticholinergics. The first one, the first and the most important one is that R1 should be carbocyclic or heterocyclic for maximal antagonist activity. So looking at the illustration before, kani siya ang R1 na to, oh. This is your R1. So ang requirement daw for anticholinergics, it should be a benzene ring or a carbocyclic ring. So this is true for our anticholinergics. Examples here, oh, trospium, oxybutynin, glycopyrrolate. So as seen here, meron siyang benzene ring for the R1. Meron siyang carbocyclic ring for the R1, for oxybutynin, and for glycopyrrolate. So it's a requirement for antagonist activity. A cyclic or a benzene ring ang R1 natin. Right? Next concept for SARs. Dapat the R2 substituent should be a hydrogen, hydroxyl, hydroxymethyl, or a carboxamide for it to work as an anticholinergic. Pero the presence of an hydroxyl group and a hydroxymethyl group makes the antagonist or the anticholinergic more potent. Like ito, R2 natin. For trospium and oxybutynin, ang R2 it's a hydroxyl group. For ipratropium, at the right portion, it's a hydroxymethyl group. Okay, so essentially, the R1 and R2 are essential for anticholinergic activity. All right, next concept for your SARs. So this time, let's talk about the X. The X substituent in the most potent anticholinergic agents is an ester, but it is not an absolute necessity for muscarinic antagonist activity. Ester siya kay kung titingnan ninyo ang structure ni acetylcholine, ester manggod ang naa sa structure. So ibig sabihin dapat somewhat mag-match-match daw. Pero in some anticholinergics, hindi necessity na ester ang functional group. Pwede rin other functional groups also. So hindi lang limited to ester. So hindi siya critical itong ester. Excuse me. All right. Fourth one, the N substituent, it's a quaternary ammonium salt in most anticholinergic agents. Kaya ang structure manggod ni acetylcholine, quaternary ammonium salt. Isang nitrogen, 4 carbon atoms attached. Pero hindi siya critical na 4 carbon atoms because tertiary anticholinergics na may tertiary amines also possess antagonist activity also. So hindi critical ang quaternary ammonium group. Okay? And the last one, the distance between the ring substituted carbon and the amine nitrogen is not critical. So hindi importante ang distance, yung number of carbons. Kasi 'di ba doon sa ating acetylcholine agonists kay meron tayong gina-follow na rule of 5. Pero dito for anticholinergics hindi siya like critical yung length or the number of carbon atoms. So essentially, for anticholinergics, ang important talaga or ang critical for its function is yung R1 and R2. Okay, so that's the SARs of your anticholinergics. R1, R2 ang important. So, bale, ang basihan sa ating mga synthetic na anticholinergics, it's on the atropine structure. So this time, let's proceed on the different examples of your synthetic anticholinergics. Now, there are 4 classes of synthetic anticholinergics, and they are based on the functional group present, yung X na substituent. So first one, we have your amino alcohol esters. Ibig sabihin nito, yung X substituent niya is an ester functional group. So we have 5, dicyclomine, ipratropium, tiotropium, glycopyrrolate, and oxybutymine. So bali ang i-mention ko lang dito ha for our drugs yung yung mga medyo important na information lang. Okay? So I'll start first with dicyclomine. Dicyclomine, it's the old name for the drug named dicycloverine. Have you heard of the brand name Bentyl? Dicycloverine, ginagamit siya sa pananakit sa tiyan, especially sa mga bata. So dicycloverine, old name niya, it's dicyclomine. Brand name, Bentyl. Ang dicycloverine, it has utility for the management of gastric spasms. So it is used for its spasmolytic effect on the GI tract. Okay, so bentyl. So if you would look at it, its X substituent ester siya. Tingnan itong ester. May ester functional group siya. Okay, next. The next two, ipratropium bromide and tiotropium bromide. These are 2 agents na used technically for the management of asthma. So they are the anticholinergics na indicated for asthma or for bronchial secretions. So have you heard of the brand name Duavent? Duavent. Ang Duavent, it's actually the combination of salbutamol plus ipratropium. So bronchodilator plus an anticholinergic. Okay, so ipratropium is for asthma, at the same time for your tiotropium din pala. It is used for the management of asthma symptoms. Okay, okay, sorry. Next, the fourth one among your amino alcohol esters, we have glycopyrrolate. Glycopyrrolate has utility for GI spasms, as well as meron siyang utility also at your urinary bladder. Spasmolytic effect siya on the GI tract as well as on your genitourinary tract. Stomach as well as your urinary bladder. And the last one, for your amino alcohol esters, we have oxybutymine. Ang oxybutymine, it is an anticholinergic particularly indicated for urinary incontinence. So it relaxes the bladder para dili siya involuntary na mag-cause og leakage ng blood, especially for incontinence. So na siya specificity for the bladder, itong oxybutymine. Okay, so to summarize, for your amino alcohol esters, we have tawag nito, excuse me. We have your dicycloverine, formerly known as dicyclomine, ipratropium, and tiotropium, and glycopyrrolate, and oxybutynine. Okay, next, we have your amino ethers. Amino ethers, examples of your amino ethers are benztropine and orphenadrine. Now, tinatawag silang amino ethers, it's because you would look if you look at its structure, instead na ester, ether ang X niya. Ether functional group ang X. Now, example is benztropine. Brand name, Cogentine. Benztropine, it's an anticholinergic particularly indicated for the management of Parkinsonism. Parkinsonism. Okay, benztropine. Okay, next, for your amino ethers, we have orphenadrine. Si orphenadrine, kay dili kayo siya like notable among the anticholinergics, pero noted sa kanya na meron siyang effect sa smooth muscle. Pero dili kay siya like memorable jud ang orphenadrine. Okay, so yan ating mga amino ethers, benztropine and orphenadrine. By the way, additional info din pala for orphenadrine, I forgot. It is used for the symptomatic treatment of Parkinson's disease. Pero dili kay siya notable jud ng orphenadrine. Okay, next. Aside from your amino alcohol esters, amino ethers, we also have amino alcohols. Examples of your amino alcohols, piperidine and tolterodine. Piperidine and tolterodine. Ang piperidine, same with your benztropine and orphenadrine, symptomatic management siya of Parkinson's disease. It is used, or it is one of the anticholinergics given for Parkinson's disease, piperidine, along with benztropine and orphenadrine. And the second one, for your amino alcohols, we have your tolterodine. Ang tolterodine, it's an agent or it's an anticholinergic similar lang to oxybutynine but has specificity for the urinary bladder. Okay, medyo specific ang kanyang action to the urinary bladder. Okay, so it is used for the management of urinary incontinence. Okay, and the last one for your anticholinergics on the basis of its functional group is your amino amides. Amino amides siya because it contains the amide functional group. We have tropicamide and solifenacine. Tropicamide and solifenacine. Ang tropicamide, it's a midriatic agent. Brand name, midriasil. Midriasil. So it's an anticholinergic for ophthalmic use. Indicated siya particularly for eye inflammation. Midriasil. Actually, present na siya sa atong market right now, ang midriasil na brand. Okay, and the next one, we have solifenacin. Solifenacin, similar lang ang kanyang activity with your oxybutynin and tolterodine. It has specificity for the bladder muscle. So therefore, it is useful for urinary incontinence. Okay, so yan ang ating mga amino amides, tropicamide, and solifenacin. So yan siya ang ating mga anticholinergics. So medyo dagan-dagan jud kung anticholinergics, no? So yan siya for our muscarinic agonists and antagonists. Okay, so to finalize the lesson on the drugs affecting cholinergic neurotransmission, we have your nicotinic antagonists. So, di ba, for our drugs affecting cholinergic neurotransmission, we have acetylcholine binding to either muscarinic or nicotinic receptors. Yung kanina, specifically affecting the muscarinic receptors. So this time, let's talk about those drugs affecting the nicotinic receptors. Pero you may ask, sir, how about nicotinic agonists? Kay di ba ating muscarinic earlier kay naman tayo agonist o antagonist. How about for the nicotinic? Actually, for the nicotinic side, ang may therapeutic utility lang talaga kay ang nicotinic antagonists or the nicotinic blockers. So sila yung may relevance therapeutically, itong mga nicotinic blockers. Particularly, ating mga nicotinic blockers, these are your neuromuscular blockers. These are agents that help relax our muscle during surgery and other minor procedures. Neuromuscular blockers. Okay, so let's talk about your nicotinic blockers. There are two main classes of nicotinic blockers. We have neuromuscular blockers and then your ganglionic blockers. Neuromuscular blockers, they are used to help relax the muscle. And then for ganglionic blockers, ang utility nila, it's more on some of which kay ginagamit for hypertension para ipababa ang blood pressure. Pero for our lesson, we'll be specifically discussing more on your neuromuscular blockers. Okay, so to give a short review of your nicotinic receptors, when acetylcholine binds to the receptor, nicotinic receptor, ang mangyayari is that it causes depolarization of the end plate. So, ang end effect ng depolarization is that it causes muscular contraction. So, yan for agonist. Kapag i-stimulate niya ang nicotinic receptor, mag-cause siya muscular contraction. Pero, when we say nicotinic blockers, this blocks the effect of acetylcholine, so therefore walang depolarization, walang muscular contraction na mangyayari. So, for your nicotinic blockers, di ba kung sa anticholinergics natin, ang first anticholinergic that was discovered was atropine. For your nicotinic blockers, the first one was your tubocurarine. So it was the first known neuromuscular blocking drug. Particularly, ang tubocurarine was used by South American natives. So it's from a natural source. So ang leaves ng plant that contained tubocurarine was applied to arrows And then, itong arrows, ginamit nila during hunting. So, these arrows, containing the tubocurarine, caused muscle paralysis either at the nerve or at the muscle of your animals. So, mo ni siya ang first of your nicotinic or your neuromuscular blockers, ang tubocurarine. Now, further study resulted to this one na discover na ang structure ni tubocurarine is ganito. So, di ba medyo complicated siya. So, modo ni siya ang structure ni tubocurarine. Now, the structure elucidation stated that for tubocurarine, it contained 1 quaternary ammonium nitrogen and 1 tertiary nitrogen. If you would look at the upper left and lower right sa structure ni tubocurarine, ang naa is for the upper left, it's a quaternary ammonium salt. For the lower right, it is a tertiary nitrogen. So modo na siya ang correct structure ni tubocurarine. Isang quaternary, isang tertiary. Pero ano ba ang significance of knowing na isang tertiary, isang quaternary? Because it was later discovered that for a compound to exhibit neuromuscular blocking activity, it should contain 2 quaternary ammonium groups. Dapat dalawang quaternary ammonium groups. It was a requirement for neuromuscular blocking activity. Pero kung titingnan ninyo ang tubocurarine, it was an exemption to the rule. Kasi hindi siya dalawang quaternary ammonium group. Isang quaternary, isang tertiary. Pero it still elicits a neuromuscular blocking effect. Okay? So because of that discovery, tubocurarine and dalawang quaternary ammonium groups, it was later found out na for neuromuscular blockers, we have 2 types. Naghanap 2 types. So for neuromuscular blockers, we have 2 types. We have the depolarizing and the non-depolarizing neuromuscular blockers. Depolarizing and non-depolarizing neuromuscular blockers. Ang ating mga depolarizing neuromuscular blockers, from the name itself, it causes an initial muscle excitation because of depolarization, followed by a prolonged blocking action. So how would you know na isa siyang depolarizing neuromuscular blocker? Actually, ang basehan kay ang structure niya. Your depolarizing neuromuscular blockers, they contain 2 quaternary ammonium nitrogen. Or quaternary ammonium pala. Ang ating mga depolarizing, they contain 2 quaternary ammonium groups. On the other hand, we also have your non-depolarizing. So ang non-depolarizing, wala siyang muscle excitation sa start. So kani siya ng mga neuromuscular blockers, they prevent depolarization and causes muscle relaxation agad-agad. So what are our non-depolarizing neuromuscular blockers? Yun siya yung tubocurarine. Yung may isang quaternary ammonium nitrogen at saka isang tertiary nitrogen. So yan siya ang history ng ating neuromuscular blockers. Started with tubocurarine, pero it was later discovered na meron palang dalawa. Non-depolarizing at saka depolarizing neuromuscular blockers. So para saan ba ang ating mga neuromuscular blockers? They are therapeutically used for the following purposes. They are used as an adjunct to general anesthesia, provide skeletal muscle relaxation that facilitates operative procedures, reduces the depth of requirement for general anesthesia. Short-acting agents are used to assist in tracheal intubation and used in corrections of dislocations and realignment of fractures. Um, Furthermore, I would like to expound itong third bullet, itong reduces depth of requirement for general anesthesia. Ang ibig sabihin nito, mga neuromuscular blockers natin, they are combined or they are given together with general anesthesia during procedures. The problem kasi with general anesthesia is that it significantly causes, one of the side effects manggod kay it causes respiratory depression. So it is a problem talaga with your anesthesia. Kaya nga may anesthesiologist tayo. Sila yung mag-monitor ng dose ng anesthesia natin. So ang respiratory depression, it is a problem with your general anesthesia. And it increases with the chances of developing depression kay it increases with the dose. Okay? So given together ang mga neuromuscular blockers para reduce ang dose ng ating anesthesia. Reduce dose, reduce chances na magkaroon ng respiratory depression. Okay, so mo na siya ang utility or uses sa ato ang mga neuromuscular blockers. However, natay side effects. Notable na mga side effects sa atong mga neuromuscular blockers. Adverse reactions are the following: hypotension, bronchospasm, cardiac disturbances, and particularly yung histamine release. So, mo na siya ang problem sa older drugs natin, older na neuromuscular blockers. It causes histamine release. So, imagine nyo lang ha, allergic reactions. So, allergic reactions varies from people to people. Pwede siya mag-hives, pwede mag-flushing, pwedeng, ang worst case scenario, kay pwede siya magkaroon ng anaphylaxis. Kana maglisod o ginhawa. So, wala siya ang side effects of your neuromuscular blockers. Okay, so let's talk now about the different drugs under neuromuscular blockers. So, muna na siya ang last part. Last part ba? Final na siya for your cholinergic drugs. For first one, di ba we have two types, depolarizing and non-depolarizing. So I'll start first with your depolarizing neuromuscular blockers. Okay, so examples are decamethonium and succinylcholine. If you would look at the structure of decamethonium and succinylcholine later on, you would observe na meron siyang dalawang quaternary ammonium group. So mo na siya atong mga depolarizing neuromuscular blockers. Structurally, it contains two quaternary ammonium groups. So depolarizing sila in a sense na it causes initial muscle excitation followed by muscle relaxation. Muscle contraction muna followed by muscle relaxation. So decamethonium yung kanina, and the next one we have succinylcholine. Succinylcholine, napod siya dalawang quaternary ammonium group, but the thing with your succinylcholine, na lang, it is used for the rapid induction of neuromuscular blockade. So ibig sabihin nito, it is a short-acting, actually rapid-acting drug gani, because of its fast onset of action and short duration of action. So expect na ang toxicity kay less likely to develop with your succinylcholine. So it is used to produce muscle relaxation during intubation or endoscopic procedures. Kay mabilis lang kanyang effect and ang yung duration dili kay siya mag-last long. Succinylcholine. So succinylcholine ha, depolarizing neuromuscular blocker. Okay, and the next one, we have your non-depolarizing neuromuscular blockers. Examples of your non-depolarizing neuromuscular blockers are tubocurarine and metocurine. Tubocurarine and metocurine. So ang tubocurarine ha, it was the first known neuromuscular blocker. Tubocurarine, it's given intravenously and has a relatively long duration of action. The problem with the use of tubocurarine is that it is a potent inducer of histamine release. So allergic reactions are common with the use of tubocurarine. So usually, ang ginagawa dito is ginasabay siya or it is given along with a steroid or an antihistamine to prevent the histamine release na related sa iyang use sa tubocurarine. Okay, and the second one, we have metocurine. So metocurine, it is fourfold more potent than tubocurarine. It has a long duration of action and is eliminated via the kidneys. So ito yung ating mga old na mga non-depolarizing neuromuscular blockers, tubocurarine and metocurine. So as you can see here, ito sila, their main problem or their main issue is with regards to their histamine release. So medyo problema to ang histamine release. Allergic reactions. Worst case scenario nga, anaphylaxis. Okay? So to compensate for that histamine release na side effect, we have newer agents right now. So ito yung mga newer agents natin, newer non-depolarizing neuromuscular blockers. So we have the first one among your newer neuromuscular blockers are the steroid-based neuromuscular blockers. Examples, pancuronium, vecuronium, pipecuronium, rocuronium. So steroid-based sila in a sense na steroid, ginaiwasan ang possible na histamine release na with your associated with your mga older na mga non-depolarizing neuromuscular blockers. So let's talk about your steroidal neuromuscular blockers. Examples. First one, we have pancuronium. Your pancuronium, it's a long-acting agent, more active than tubocurarine. Dili kay significant ang allergic reactions with your pancuronium, but the problem with your pancuronium is that it can increase heart rate and blood pressure. So dili siya pwede ibigay for persons who have coronary artery disease. Kay it will worsen the condition. Okay, so pancuronium. Next, we have your vecuronium bromide. Vecuronium bromide has an advantage of not inducing histamine release at normal doses. And kung ikumpara mo siya with your Pancuronium, it does not exhibit significant cardiovascular effects. So safer siya ang vecuronium. Okay? Next, pipecoronium. Pipecoronium, it's a long-acting neuromuscular blocking agent with minimal cardiovascular effect. However, it is contraindicated in persons who have renal failure. Kung ang pancuronium bawas siya for coronary artery disease, ang pipe, as much as possible, it is used in caution with patients who have kidney disease or renal failure. And next one, the last one for your steroid-based neuromuscular blockers, we have your rocuronium bromide. Rocuronium, it's an intermediate acting agent kasi yung previous kasi mga long-acting agents yun sila eh. It has a rapid onset of action and it does not appear to cause significant histamine release. Now, additionally din pala, tinatawag silang steroid-based neuromuscular blockers in a sense that it contains the steroid nucleus, the CPPP nucleus. Cyclopentano perhydrophenan 3 nucleus. Kani siya on a nucleus of your steroids. Okay? And the last one among the newer neuromuscular blockers, aside from the steroid-based, we have the tetrahydroisoquinoline neuromuscular blockers. Tetrahydroisoquinoline blockers, sorry, first one, the most important one, it's your atracurium becylate. So it's a non-depolarizing neuromuscular blocker. Its duration of action is slightly longer than succinylcholine. And its advantage is that it can be given in patients who have hepatic or renal disease. It can be given for persons who have hepatic and renal disease. So bakit siya pwede ibigay sa persons na may hepatic or renal disease? Kay the problem mainly with persons na may hepatic or renal disease is with regards to their elimination sa drugs ba. So paano ba eliminate ang drugs? Through your liver or through your kidneys. Pero kani siya ang atracurium, hindi siya metabolized by the liver and hindi din siya eliminated by the kidneys. So ibig sabihin nito, ang elimination niya is not reliant on those functions of those organs. So ibig sabihin, pwede siyang ibigay. It is safe to be given for hepatic and renal disease. So bakit? Bakit siya pwedeng ibigay? It undergoes the so-called Hoffman elimination. Hoffman elimination. Ibig sabihin ng Hoffman elimination, it's an elimination method by which your plasma metabolizes the drug. So hindi kidneys, hindi liver ang mag-metabolize or mag-eliminate, kundi ang plasma ninyo, yung dugo ninyo ang mag-eliminate. That's why, as you can see here, ang iyang onset o iyang duration of action kay mabilis o shorter lang siya. Kay plasma man ang mag-degrade. So, ibig sabihin nito, exposed kayo siya to degradation over time. So, short lang ang iyang duration of action for atracurium becylate. Brand name, Tricrium. Okay, so that's for atracurium. And the last two, mivacurium. chloride and doxycycurium chloride pala. Both of these neuromuscular blockers are hydrophilic. They have a small volume of distribution, and they are primarily distributed to extracellular fluids. Ibig sabihin ng small volume of distribution kay it will retain more in your plasma. Mas magstay siya more in your plasma. Okay, so similar lang sa actually. And yun lang. Yun lang. So that's for our lecture for drugs affecting cholinergic neurotransmission. So we ended with our nicotinic or neuromuscular blockers.